You probably heard the myth that MPox is not real, or that MPox is chickenpox, or that MPox affect a certain group of people. What are the prevention strategies? How to stay protected, or whether MPox is chickenpox?
My name is Dr. Muhammad Rumeh. I'm an emergency physician at Life Care Hospital, Freetown.
Can you please tell us what is MPox?
Well, MPox is a viral infection. It belongs to the pox family. It was first discovered in 1970s in Africa, and it has been quiet for some times, but unfortunately there have been some outbreaks recently here in Africa, but also in the United States.
Okay, so where does it come from?
Well, it was first discovered as a zoonotic infection seen in between animals like monkeys and other rodents. But recently it has been discovered that it can be transported from animals to humans or between animals in between humans and humans.
Okay, how is mpox different from smallpox or chickenpox?
Well, mpox is related. It is the same family of smallpox, but it's not related to chickenpox, unlike what some other people think. They both have like these box lesions on the skin, so they can be quite difficult to distinguish from each other. But we can be diagnosed differently by doctors and medical examination and investigations.
Okay. So, what are the primary ways mpox is transmitted from one person to another?
So the main way that the mpox is transferred is through direct skin-to-skin contact. It can be also transmitted through body fluids, and it can also the human can get infected if they can get in contact with the affected animals. Some think that it can also be transported in sexual sexual relations with each other.
Yes, that was the question I was going to ask. If mpox can spread through sexual contact.
Well, right now it's not. They are not sure 100% that the sexual intercourse itself can infect the human, but the close contacts during the relation can and is the main way that mpox can be transferred.
So you're trying to say person can get contacted through physical interaction.
That's right. Yes.
Okay. Are certain group more certain than others? I mean, like if a certain group,
Yeah.
or different people can get transmitted.
Yeah. So people with very low immunity, like elderly people with immunosuppressed conditions, like people with chronic diseases like hypertension, diabetes, people with cancer are more susceptible to infection and more susceptible to getting more severe ways of conditions of the disease.
Okay. What are the early signs or symptoms of mpox?
So the symptoms of mpox is quite vague, but usually the most symptoms can start with signs like fever, headache, body weakness, and then it starts to forming skin lesions, rashes. Then it starts forming these box lesions, which has like blisters filled with fluids or pus. After a while, from between 2 3 weeks, these lesions start to scale off, and yeah, these are the main symptoms of the disease.
So how does mpox progress once someone is infected?
So, like I said, it started with fever first, headache, body weakness. Then these lesions start after 1 to 2 weeks.
Okay.
The lesions start to occur on the body. After two or 3 more weeks, these lesions came off and fall down.
So how is mpox diagnosed? Clinically or through lab tests?
Well, first it can be diagnosed clinically through the symptoms that I just mentioned. But then we can also diagnose it by investigations like taking swabs from these lesions because, like I've mentioned, the symptoms can be seen in other diseases like chickenpox and other skin lesions.
Yes. Okay, so how do we differentiate it from other skin infections?
Yes. So if a patient is suspecting that he or she has a mpox, they need to be seen by a medical professional.
Okay.
Through the clinical picture of the patient, they can distinguish it from other diseases, but the swabs that is taken is the most definitive way of diagnosing the mpox.
Okay. Is there a specific treatment for mpox?
Unfortunately, right now there is no cure for mpox like many other viruses like chickenpox and also smallpox, But there is treatment that we do, which we call supportive treatment, is that we treat the symptoms of the patient as they go. There are also some antiviral drugs that can be used, but they are unfortunately quite expensive, and they are not specific for MPox. They are used to treat for other viral infections. We sometimes use it to treat MPox, especially in severe conditions.
Okay, how long does recovery typically take?
Usually, if a mild case, it takes from 2 to 4 weeks for the patient to fully recover from MPox. If the patient unfortunately gets a more severe type of the infection, it can go for more than that, maybe a few months.
Okay, so how are symptoms normally managed?
Usually, we manage symptoms, like I've said, as they go. For fever, given antibiotic, anti-fever drugs like paracetamol. For the lesions, we use things like calamine lotions. We use cold compresses. Some use like salt bath. If you sit in a salt bath, they can help heal the regions more faster.
Okay. Can you please tell us how people protect themselves from MPox?
So if someone suspects that one of the family or relatives of close contact, they have MPox, they need to isolate from them for a while, for a period of 2 to 3 weeks at least. They need to avoid any close contact with the patient. Then they should take an advice from a medical professional about what they would do next.
Right. Is there a vaccine?
There is a vaccine for MPox right now. It's totally safe. It's a 2-shot dose that needs to be taken.
Okay. So who should actually get the vaccine?
So the priority should be for those who are more likely to encounter MPox, like healthcare professionals, elderly patients, like I've said, any other more susceptible in the population.
So how effective is the vaccine? And there is any side effects?
Of the vaccine? No, the vaccine, like I've said, is totally safe.
Okay.
There is no indication that it can cause any infection.
Okay. How effective is the vaccine?
How effective is the vaccine?
Yes.
What do you mean? I'm sorry.
Because there are certain people who don't believe in vaccine actually.
I know. So no. So vaccines, mpox vaccine, like any other vaccines, do not cause infection. They are used to they are used to protect the human, not cause infection. They might cause some mild irritation, mild symptoms like fever that will go away just in a day or two, but vaccines don't cause any infections.
Okay. So what advice do you give to someone recovering at home?
So you just need to take care of themselves. They need to eat well, need to relax, and treat the symptoms as they go. If they have any fever, they need to take medicine like paracetamol. They need to take, they have any weakness, they can also take paracetamol. If things go far, they should seek any medical advice. They should also isolate to protect other close family members.
Okay. So how does
Sure.
hygiene and isolation play?
So hygiene plays an important role in mpox, like any other skin lesion diseases. They should use like for so hygiene should be like every other day. You should wash themselves. They should use salt water for cleaning, especially if someone is already infected. It can help heal the lesions fast.
Okay. So some people believe that mpox is chickenpox.
No,
Truly.
no, they are totally different families. They are not related to each other. The only thing is common is the word pox, which means the type of lesion that occurs on the body. That's why some people might think they are both related to each other, but they are totally different types of diseases.
One more question, just one. How prepared our health facilities to deal with this? Or are you guys prepared?
Well, the government, I understand the Sierra Leonean government have taken some steps. They have the government hospital. They have set up some of the major government hospital as an isolation center. So I think this is a very good start to this. But the government needs some international help in containing the disease.
Thank you very much.
Thank you, President.
That's all that's it out. Thank you.